Katrina Andrews, and this is my introduction to National Opioid Crisis. I've prepared a PowerPoint to present to my co-workers here today. By the end of this presentation, you all will be able to ID opioids commonly used and abused by people, ID signs and symptoms of people who abuse opioids, how to help people who have abused opioids, and other resources to help them. It is estimated that 2 million people in America today abuse opioids. 90 people die daily from opioid overdose. With this increase in number, it makes it hard for the healthcare workers to provide help for the people who come in with opioid abuse, and it makes it harder for physicians to give scripts to patients that really need them versus the ones that do not really need them. It also increases the supply and demand on equipment used to help save people who abuse opioids. Some commonly abused opioids are hydrocodone, which is also known as Norco or Lortab, Percocets, Dilaudid, Demerol, fentanyl, and morphine. Recently, on the news, it was reported that fentanyl has become abused more than any other opioid by overdosing on it. Some side effects and signs that you may see in people with opioid overdose includes in lay people, they may change friends. The friends they once had were not known to do these type of things, but the ones they're with now know exactly how to get the drugs and what to do with them. They may be anxious, paranoid, hallucinating, avoid family functions, or maybe just lose interest in anything that they ever once did. Now, with us being healthcare workers, we've all worked with people who've abused opioids. What about that healthcare worker or co-worker that comes in and always takes trips to the bathroom? Whenever something is needed, they're never anywhere to be found. Or maybe that co-worker that always picks up all of the extra shifts that nobody else wants. Or they always want to work night shifts or the double shifts because it gives them more access to the drugs. Or maybe that one patient that's not able to voice pain, but whenever that worker works, you notice that the PRN narcotics are always given to that patient around the clock. If it says every 4 hours, that patient gets that medicine every 4 hours. These are things to look for in healthcare workers. Also, disheveled appearance. They just get to the point where they don't care what they look like or how they come to work. Erratic behavior. Always into it with the other co-workers. They don't know how to control themselves. These are the type of behaviors to look out for when you're working in healthcare with drug abuse. Then you have that one patient whose patch is always missing. No one knows what happens to the patch. But then when you go to your supervisor, you report the patch missing and drug tests have to be performed. Then the patch mysteriously comes back up. Those are things to look for. And then there are ways to help people who are abusing opioids and possibly overdose on them. You can try drug screenings, opioid risk assessments to see if they're at risk for opioid abuse. You can even do an assessment on the family members to see if they are at risk for opioid abuse. So what happens if you come to that one patient or co-worker or just person in general who's overdosed on opioids? What do you do? If you call their name and they're able to arouse, try to keep them aroused. If you call their name and you try to arouse them and you can't arouse them, then you need to perform CPR and scream for someone to help you to dial 911. always, if you see something like this going on, or you suspect that someone is abusing opioids, try to get them help. The best thing to do is to educate. And if you're working in healthcare and there's a problem with a co-worker who you suspect is abusing opioids, try to report that, because you have to think about the safety of the patient. And always educate, educate, educate. Are there any questions? I want to thank you all for listening to me in this presentation. Thank you.